Food Talk with Danny Nierenberg. So please sign up wherever you listen to podcasts. Today, I get to talk with Dr. Alan Greene, a pediatrician who, with his website, drgreene.com, tries to make pediatric advice more accessible and easy to understand for not only parents, but really for all of us. His goal is to improve children's health by informing and inspiring those who take care of them. In addition to many other accolades, he's also a past president of the Organic Center, one of my very favorite organizations. Thanks so much for joining me today, Dr. Greene. I hope you're still healthy and safe since the last time we spoke.
I am. Thanks, Danny. Great to be with you today.
Thanks. I hope you don't mind, but before I start, I want to give, we've been thanking a lot of frontline healthcare workers, those on the front lines of the food system during this podcast. But I want to give a shout out to, so many parents out there who, have been at home with their kids in lockdown for a lot of weeks now. And I want to give two people in particular a shout out. One is my stepkid's mom. She has, been a trooper. We, both my husband and I have older parents in the area. She has an older parent who lives near her, and she decided to, together with my husband to, make sure the kids were safe and healthy in the suburbs with her. And I know it's been weeks and weeks of, figuring out how to homeschool and keep kids entertained and fed. So I really want to give her a lot of credit for stepping up to the plate. And I also want to give a lot of credit to my husband, who hasn't seen his kids now in more than a month. And he reads to them every night. I know it's a really hard time for, all four of them as a family.
Sure.
And so I just wanted to give them, the credit that they deserve, because they're doing their best, as we all are trying to do during this time. But I know it's quite difficult for parents. So thanks for listening, Dr. Greene.
I'm glad you did that.
Yeah, I'm sure you're getting a lot of it's a hard time for parents right now, right?
Oh, it's a really hard time, and it disrupts everybody's schedule, either getting to be with your kids or not getting to be with your kids all the time. Right. It's really rough and really different. Yeah.
Well, one of the things
we're living really in
Absolutely. Go ahead.
Oh, go ahead.
No,
I was just going to say, we're living in such an unprecedented time.
Right.
This is the first time in the history of the United States that all 50 states have been under a federal emergency declaration. And just recently, COVID has become the leading cause of death in the United States. About 8 days ago, it surpassed heart disease as a leading cause of death. So It's very disruptive. But there's a lot of glimmers of good news for parents in the midst of all this, too.
Well, one of the things that I've enjoyed about what you're doing is you've been creating these viral videos for parents and kids around COVID-19. Can you describe what you've been doing?
Yeah, so I'm also the chief pediatrician of a group called Eat Real that's focused on getting real food, especially to kids, through the food system. The food system is in many ways one of the largest restaurants in the United States.
Absolutely.
And in the school, And so through school foods, many people, there are 30 million kids that depend on that as a key part of their nutrition. And that was true in general. And before COVID broke out, we were working on changing that system. But since it has broken out, these kids that are staying at home are not just missing being with their friends, not just missing the schoolwork, not missing sports, but they're also missing out on that key part of the school system. It's not designed for this. The infrastructure is there to still continue to provide meals for families, but not to safely deliver them. So at Eat Real, it's an agile and small organization, so we quickly moved to training and helping to deliver these food safely to people during the midst of all this. And we are now delivering 1 million meals a week to kids and making a difference there. But part of that is training people. How do you safely connect? How do you use a mask if you've never used a mask before? How do you handle food in a way that's safe? And so I've been working together with IDEO to create videos to make it super simple and easy to do.
Great. That's great. No, and it's so helpful and useful for everyone as we think about this. I'm so glad you're delivering 1 million meals to kids. Why is that so important right now? I think a lot of us don't understand that that often kids are the only sort of nutritious meal they're getting all day because of they live in underserved communities or their parents are out of a job is really at school, the only nutritious meal. So why is it so important now? I mean, obviously you don't want kids to go hungry, but also keeping their immune systems healthy during this time is really important.
Well, the WHO recently said that the number one thing people can do to boost their immune system is to eat real nutritious food. And so this is a time where if you didn't have access to that, you end up with the comfort food and junk food and overly processed food that can contribute to the problem. If you look at the biggest risk factors for somebody getting COVID and getting really sick, a lot of them are related to the food that we eat, whether it's high blood pressure, obesity, type 2 diabetes are three of the biggest risk factors. And all of that's related to our body's response to sugar and insulin, and our insulin response to sugar and processed grains. So getting real food right now is more important than ever.
Absolutely, absolutely. What is, I'm sure you're getting a lot of questions on your website from parents who are trying to deal with, feeding their kids at home and trying to make nutritious meals. What are some of the most common questions?
Well, one of them is just what can we do that will be fun and delicious that the kids can eat. And so that's another viral video that we just have been working on, something called the Rainbow Taco Challenge. And the basic idea is open up your refrigerator as a family and look at your produce bowl if you've got one of those, and put together the most colorful taco you can. And so I did that online, and we've got over 30 top chefs this week doing it, farmers, grocers, entrepreneurs, artists, athletes, maybe you, to do that.
Love to.
And so we just took the stuff that was in there. I didn't have tortillas, so we did it on just a big lettuce or romaine lettuce wrap taco. And it was one of the tastiest meals I'd had in a long time. And people seeing a fun, easy way to make something that's tasty is really useful. Another question that I'm getting a lot right now is it safe to eat produce? I'm worried about getting something from a farmer's market or from a produce aisle. Maybe that's carrying the virus. And the good news is that is very safe. You still want to wash produce the way you normally would. But at UCSF, they've been studying, do people get COVID from food? And so far, there's never been, out of the couple million cases that are out there now, a case that's been traced back to food. And it doesn't tend to live long on food, and this tends to be something we get from inhaling it, not as much from swallowing it, since the acid bath in the stomach is pretty good at killing stuff. So it's much better to eat produce than to avoid it.
That's great advice. Thank you for sharing that. I think your website offers so much for people during a really uncertain time and unprecedented time, as you mentioned before. What are some of the mental health challenges that kids are facing during this time? I mean, they can't see their friends, they can't go to school, they can't, and often, really leave the house or their apartment.
Yeah, in childhood, especially as they move along during childhood, the drive to connect to friends is really deep and strong and biological. And especially by the time you get to adolescence, the biological imperative is to get out of your house and to connect with others. So this is very challenging. And kind of related to that, one of the top questions I'm getting right now is about screen time. Parents feeling guilty for their kids having more screen time. And one of the things I do is have out screen time in different buckets. All screen time is not created equal. There's one bucket is the passive screen time where you're sitting and watching a movie or TV show. And another is the interactive where you're playing a game and using your mental wits or your agility or something to try to win a game. Another is creativity where you go and you create content. You write something or you record a song or do something that's creative. And then the last one is communication, where people are in different places connecting with each other through a screen like we are right now. And for the passive just watching something, usually I say it's best for kids no more than an hour a day. Right now with schedules upended, I'm fine with a couple hours a day. And even the interactive games, I tend to say no more than about an hour a day. Now I'd say a couple hours would probably be fine with that. But the other kinds of screen time can be really valuable. And I would lean more on those where you're actually doing something to create something for somebody else or to share with others and connecting with friends. It's really important to stay connected.
Absolutely, absolutely. Because we don't know, whether you're an adult or a child, none of us know when this will end, and how long we'll have to be in lockdown. So it's, again, uncertain. Is there certain language that you could use around children to describe this time so that they understand sort of the gravity of the situation that we're all in, but they also feel comforted and safe?
Well, I think it's really good for kids to hear the message that out of everybody in the population, they're the safest. That they tend to get it much less often than other people, get sick from it much less often than other people. And if they do get sick, the chances of it being serious is really, really tiny. But they can play a big role in keeping other people safe. And that's
Right.
the reason that we're at home right now, is that you can make a big difference for others, for your family, for your loved ones, and for others in society.
That's great. That's great advice. I want to switch gears a little bit. Your website has been online and active for 25 years, which is
Mhm.
astounding to me. What changes have you seen, that from both kids and parents, over that of a century about, their knowledge of the links between food and health and some of the other things that we've spoken about?
It's really changed quite a bit. Early on, when we started, it was the AMA said the pioneer physician website. As far as we know, no other doctors online answering questions at the time. And so people didn't have access. There wasn't Wikipedia, there wasn't Google. It was hard to get health information. So we tended to get a lot of things on pretty serious illnesses that nobody knew what was going on. There were very few questions about food and medicine, not that much understanding about the deep connection between food and medicine.
Mm-hmm.
But as other resources have gotten easy for people to get just straight information about things, people are much more interested now in why and how and what's underlying this. I want to understand what's going on. And as that's been increasing, there's been a real increase in the link between food and health.
That's fantastic to hear, and I'm glad people are more interested, especially parents, because if you can teach those habits early on, then you really have set up your kids well for a lifetime of health and wellness.
That's so true. I mean, we know that what and how kids eat as children, we obviously know it affects their weight. There's a whole obesity epidemic going on in childhood. But it also affects their potential, the height that they're likely to reach, and how likely they are to get sick as a kid. And how many times a year they'll get sick. And if they do get sick, what they eat and how they eat impacts how quickly they'll recover.
Mm-hmm.
And it's not just these little acute illnesses, it's how likely they are to develop chronic illnesses as adults, but even as kids. There are now millions of kids in the United States with hypertension, and it's mostly related to how kids eat. Wow. And it impacts their mood, their behavior, how well they do in academically, how well they do in sports. And what kids eat and how they eat as children impacts how long they're likely to live. I mean, it's huge, the difference you can make with great food.
Absolutely, absolutely. As I mentioned before, you were a big part of the Organic Center's work, and I know you took a challenge about a decade ago to only eat organic foods. And I want you to sort of maybe describe that process and what sort of changes you saw in your own health, if any.
Well, it started, I was actually standing out in a pasture of an organic dairy, and the farmer was talking about how they had switched their herd to organic and how the vet used to come out all the time. And that once they all were organic, the cows just were so much healthier. And you could see it in the herd, and mentioned that all the organic farmers that he knew had the same experience. And of course, you could never do that experience in a human because there's just not enough organic food available.
Sure.
My ears pricked up, and I thought, wait, there's got to be a way to do this. So went home and sat down with my kids and my wife and said, what would you think if I tried to eat entirely organic for a year and see what happens? Mm-hmm. And so they liked the idea, and we set out because I thought at the end of a year, it looked like I would be actually could get certified organic at the end of a year. And so went and took every blood test that was easily available to get a measure of my own health. And I was pretty healthy already, but then decided I would only eat something if it was certified organic or wild or homegrown that I knew was grown organically. Otherwise, I was off the food grid. And I felt great. My energy levels increased. I slept better. People said I looked better. I lost some weight. And it was pretty marvelous. I ended up, for a number of reasons, extending that for 3 full years.
Wow.
And then at the request of family and friends, I stopped doing that just because it was awkward if I would go someplace and there wasn't organic food. People felt bad. Sure. And I didn't feel bad. I was fine just waiting till the next meal, but it was awkward. So I still eat organic whenever it's the available choice.
That's interesting. I wonder how, you're a practicing pediatrician. Is that something you talk to with your patients? I know you talk about diet and how it's related to health, but do you talk about the issue of organic and how it's related to health?
Yeah, I do talk about the issue of organic, both in general, but also each of the little pieces of that. Little things. Yesterday, I was talking to somebody about food dyes, the artificial dyes used in the United States that are not allowed in organic foods. And there was a big study in Southampton, England, done by their equivalent of the FDA, where they took kids, took them off of all the artificial dyes, and then looked at their behavior, and it was all better. That was not too shocking. But then they gave the kids either a shot glass full of a juice that was colored with the artificial dyes or natural coloring. And the kids didn't know which they were getting, and the teachers didn't, and the parents didn't, and they measured their behavior on ADHD scores. And the weeks the kids had the dyes gone, their behavior was so much improved, it was equivalent to taking an ADHD medication.
Wow.
So in the UK, they don't use those dyes anymore. But in the US, so many kids' foods are still loaded with those.
And what kinds of foods? Are we talking about, like breakfast cereals, sugary breakfast cereals, juices? What are the kinds of foods that parents, if they don't want those dyes as part of their kids' diet, should avoid?
Pretty much anything that is colorful and not organic there's a high likelihood. You can just look on the label and see FD&C number, whatever is the color that's in there. But it's also things you wouldn't expect, like the coloring in a vanilla shake or the coloring in breakfast cereal that looks just like a normal toasted cereal, maybe a food coloring as well.
Great. Thanks for the explanation. You've been doing this for a long time, as I mentioned before. Do you think it's harder now than it was when you first started to get factual information about food, diet, health, environmental sustainability, or is it easier? I mean, we have such a wealth of technology, but sometimes it's overwhelming for parents, especially.
Yeah, I think the answer is both. That the information is now there and available, but it's also swamped by so much misinformation and other information that being able to locate it and find it is a bit harder.
Absolutely. Any website suggestions besides yours, of course, that you'd like to share for parents?
Well, I mentioned Eat Real before. It's a real resource, not just for delivering meals during COVID, but as a way for people to learn about healthy food, particularly for kids. The Environmental Working Group is another great nonprofit that has lots of information that I think is really useful. And I've done work with them in the past too. We did a study looking at chemicals found in babies at the time of birth together a long time ago.
Wow, so interesting. Their EWG report card on different kinds of foods and how laden they are with pesticides or not is a really useful resource. So Eat Real, the Environmental Working Group, and of course drgreene.com. We'll list all of these websites on our website, foodtank.com, where you can find out more about Dr. Greene. Dr. Greene, my last question for you is, you're a doctor, you're on the front lines of this pandemic right now, as so many people are. Is there anyone you've been particularly inspired by, or who's made you hopeful that we'll come out the other side of this, that that there's a way that will human ingenuity and our human spirit will make us get through this?
Well, first of all, I am extremely hopeful that we will get through this, and hopeful that we're already at or near the peak of this first wave of what's going on. Just in the last weekend was the first time that the U.S. Total number of deaths went down 2 days in a row. So the exponential growth appears to be behind us. So even in the hard-hit areas like New York City, over a 3-day average over the last weekend, they had a decrease in new hospitalizations, a decrease in new ICU admissions, a decrease in ventilators that needed to be used. So there is light at getting better. The ingenuity coming together in solving problems. I've been part of a NASA task force in this last week.
Wow.
People, experts from all over the country got together, so creative, so ingenious about solutions going forward. But I have to say I'm most inspired by parents. And being there for their kids at home in a whole new way of being, it makes me really hopeful for where we're headed as a society.
Yeah, me too. I mean, my own experience with watching my kids' mother and my husband sort of create this new way of parenting their family has been really interesting to watch, and has been very inspiring to me. And a lot of what I'm hearing from friends is there's of course a lot of frustration, but also a lot of closeness, and this is an opportunity to create different family traditions and things
Yes.
that like these kids will remember during this time. So maybe they won't remember how scared everyone was, but they'll remember how close their family was during this time.
Yeah. After the plague, immediately after the plague just ravaged Europe, came the Renaissance, and that wasn't an accident. They were forced to think in a new way and act in a new way, and I think we are on the verge of a lot of new thinking, and I'm very excited about that.
Me too. That's an excellent note to end on. Dr. Greene, thank you so much for all that you do. Again, Dr. Greene, drgreene.com. We'll have that website available on our social media and website. A reminder that this episode will also be on Food Tank's podcast, Food Talk with Danny Nierenberg. And please join us back here next week, every day at 1 p.m. and 5 p.m. Eastern Time, when we'll be interviewing a range of experts from philanthropists in the food world to FAO experts and farmers. Thank you all. Dr. Greene, please stay well.
Thank you, Danny. Anybody who does want to do the Rainbow Taco Challenge, it's just hashtag Rainbow Taco Challenge.
Awesome. Thank you so much. Take care.
Thank you. Bye-bye.